Alaikum wa rahmatullahi wa barakatuh. Welcome to Sasa Media. Today we have a special guest, Dr. Shafi'i. Dr. Shafi'i, welcome to the show.
Thank you.
Today our topic is preventive health. For us to prevent things, we have to make sure that we get ahead of the problem.
Right.
What other diseases do you think that are ailing our community that's also preventable?
So one of the biggest issues right now is hepatitis. Hepatitis B, hepatitis C. So those two viruses are very high in our community compared to the general population, whereas in Africa, parts of Asia, South America, it's also high and it's affecting everyone equally. Here in the United States, we're seeing that in the Somali community there's a high prevalence of hepatitis B and C compared to the general population.
So especially here, living in America, with all the resources that's available, why do you think there's disparities in that area?
So people don't understand that it's as big of a problem. So that's one thing. People don't know that these viruses can cause chronic liver disease, liver failure ultimately, and can also cause liver cancer, which is also high in our community. So it tells you that in our community there are not other risk factors that are seen in the non-Somali community. For example, alcoholism might be one big problem, or chronic alcohol use, or obesity, which is now becoming a problem in our community too, but which can cause chronic liver disease and then can lead to liver cancer. But in our community we see a high prevalence of hepatitis B and C. We also see a high prevalence of or high incidence of liver cancer, and these two are directly related.
So then what is the steps that we can take to make sure that then we prevent these diseases from getting worse or becoming worse within our community?
So step one, knowing that there's a problem. I think that's part of what we're doing today is making people aware that this is an issue, and it's a preventable issue. So things that can be done. One, know whether you have hepatitis B or C. And the way you know is you can get a blood test that tells you if you have hepatitis B or C, or if you've been exposed to hepatitis B or C, and if you're recovered from it, or if you have a chronic infection that you're not aware of. So you don't have the symptoms, but the virus is still in your liver and causing damage.
Okay. So would it help then when people visit their regular doctor, their primary care, and for them to get screened as well? Right?
Absolutely, yeah. So people go to their doctor all the time and get blood tests to monitor their diabetes or get some other tests. And so to ask if you haven't had screening before for a blood test that looks to see if you have hepatitis B or C, it's simple as putting orders in, and they can be collected at the same time as other blood tests.
So where do you think we add with the screening within our community? Is it as high as everybody else? Are we lower? How do we fare as far as screening goes?
For hepatitis, there's yet no data. Data comparing the two populations, but we know that based on a study that was done here about 10 years ago, that about 50% of the Somali people that were screened just randomly had previous exposure to hepatitis B or C, and 15% actually had chronic infection that they may not have been aware of. So that tells you that more people need to be screened, because those numbers are very high. And if you haven't been screened yourself, make sure to go to your doctor and then get that blood test.
So just for a follow-up, in the last episode you said that for vaccination hesitancy a lot had to do with trust, right? Not trusting, or there was people thought that somehow there's a correlation between autism and the vaccination of measles and so on, and therefore a lot of people dropped off. And now, since creating these kind of programs to make sure people get back on board and make sure that they're vaccinating their children for protection for their family and for the community, then why are there's not so many screening within our community when it comes to cancer, when it comes to all these other as well? Because one of the things that we know, that the sooner something is diagnosed, the best, the more care that you can get, right, before
Right.
it spreads, before it really does damage to your body.
Right.
Then what is one thing that's keeping from our people going to their doctor, or just voluntarily asking these screenings? Once they're already there as well, do you still think that it's a trust issue? Do you still think that maybe it's a knowledge issue? What do you think that can contribute to that's giving our community a low screening numbers?
Yeah, I think one, trust issue is always big. The other thing is people don't want to go to the doctor unless they're not feeling well.
Okay.
And so preventive health has not been in at the forefront of our mind when we were in Somalia, because everybody's trying to survive, basically. So for the first time, people are hearing about screening, blood tests, the vaccinations, cancer screening.
It can look like the doctor's doing too much.
Exactly. It looks like, hey, you're doing too much.
Yeah.
You're not really treating what I came here for. You're trying to do extra. So
I have a headache. It's your problem.
right. Or other people are also worried about cost, and so cost is one issue. And then logistical things, like some people are not able to go to the doctor because they don't have transportation that's reliable.
Language
barrier. So there's a lot of things that from the healthcare perspective, we're trying to improve or remove as a barrier. So interpreters, connecting people with social workers so that they have some resources. So a lot of those things can help.
Okay, so then just to sum it up, so the biggest takeaway about this episode about preventive healthcare is make sure you know your status, right? Know that and the other thing is get screened early, and then connect with your primary doctor about anything that you're feeling or anything that you might be missing. Be the biggest advocate that you can be for yourself and for your family, right?
Right, and I want to add a couple more things that for preventing hepatitis B and C and their complications. So hepatitis B, there's a vaccine for it, and this is a vaccine that's been around for a long time. I know it comes back because we know it works. It has worked historically. There's a controversy surrounding COVID, so I'm not going to touch that. But I just want to say that because of the recent memory, people are even more hesitant, and there's a lack of trust regarding vaccines. But when you go back in time and you look at all the diseases that we had and the disease that we no longer see, part of that solution was the vaccinations that have been done. So for hepatitis B, there's a vaccine that's either 2 doses or 3 doses. And so if you don't have hepatitis B, but you're in a high-risk community, or you can get it from somebody, typically you get it from either exposure to blood or body fluids. So if you have a partner that that has it and they don't know, you can get it yourself. A mother can give it to her child. So all of that, it's a big risk. So you get vaccinated with either a 2-dose series or a 3-dose series, and then that's it. You're done for hepatitis B.
And these are lifetime.
There's a lifetime.
Okay.
Yeah. So so hopefully anybody who doesn't have any exposure but could be exposed would get the vaccine for hepatitis B. For hepatitis C, a lot of people don't know that they have it if they're already infected with the virus, and if they find out that they do have it, then the treatment is a 2 or 3 month course of.
Jazakallah khair, doctor. Again, the biggest message overall is please make sure then you're up to date with your vaccination. You're consulting with your primary doctor, things that affect you and that can also affect your family as well. And again, with the preventive health, as the name suggests, is preventable if everybody does what they're supposed to do. Dr. Jazakallah khair. Hopefully we can do this more often. You and I can, consult about things that are important as far as health-wise for our community and the steps that the community can take at large.
Thank you. Yeah, appreciate your time.
With Jazakallah khair.